Okay, good morning, good morning, good morning. Dr. Peter Holst here, and welcome to our Facebook Live, Middletown Health, Wellness, and Chiropractic. You know what? We've been doing this SoftWave, this awesome technique, this therapy, for about, not August, will be a year. And we've done plenty of testimonials from patients who have enjoyed the benefits of receiving SoftWave in the office. And it occurred to me that maybe it's time that you heard from me about my testimonial. So it was a year ago, May of last year, that I first saw an ad come across my computer talking about how this technology can help people avoid major orthopedic surgery. And it caught my attention because that's what I was facing. My left knee began about 25 years, so it's a 25-year in the making left knee problem. Not sure exactly how it happened. I know that I was a lot heavier and I was twisting in and out of a car, low car, so I kind of hurt my knee a little at a time over 25 years. Thank God it was more off than on, but for about 6 months prior to, so like the beginning of the year 2021, my knee started to bark at me all the time. It kept me from sleeping. It just wake me up all the time sleeping. I couldn't sit for more than 5 or 10 minutes without pain, and I couldn't go down the stairs. So for the first time in 25 years with my knee, I went to an orthopedic surgeon and took an x-ray, bone on bone. So I had the obligatory cortisone injection, lasted for about a week and a half. I had a second cortisone injection, after 3 months, and that lasted for about a day and a half. I did the one-shot gel injection, and that didn't do anything but make them $2,000 richer. So my last conversation with the orthopedic surgeon was, you got bone on bone, you got two options: learn to live with it or get a total knee replacement. And you know what, as I tell all of my patients, I'm an original equipment sort of guy. I like what God gave me, and the thought of somebody cutting this out, throwing it in the garbage, didn't make a whole lot of sense to me. And you know what, there are lots of patients who have gone through the surgery successfully and are enjoying a good life, but I've heard too many horror stories, and unfortunately, if you're one of the horror stories, you can't undo it. You can't go back. So I opted not to have the surgery at this time. SoftWave has been awesome for me. Now I can sleep without pain. I can sit without pain for any length of time. I can drive 3.5 hours to see my grandson down in southern Pennsylvania. So it's been a godsend for me. I can go up and down stairs. Is it 100%? No, not yet. I anticipate it will. It is a healing. It is one of the only tissue regeneration therapies that I know that's out there on the market. So how it works: the applicator is an unfocused head. Many other similar technologies have a focused stylus that creates a mechanical shock that goes out and damages tissue. This is different. This applicator is what we call unfocused, is a wider distribution of therapeutic benefit. Inside the applicator here is water, and that water flows back and forth between the machine and the applicator. Within the water, there's an electrode, and that electrode sends out a spark that sends a sound wave out through the water and the membrane here at over 3,000 miles per hour, 3,355 to be exact, miles per hour that comes out. And what it does is it creates a shearing action on the cell membrane, making the cell membrane react by reducing inflammation, by causing this thing called angiogenesis, which is the formation of new blood vessels. So your body is actually prompted to produce more blood vessels, so more blood comes in for healing. Awesome thing our body does. And the third thing it does, which the machine has been come to be known for, is that stem cell activation and aggregation. It causes your own stem cells to come into the area, so as old degenerated tissue dies off, new stem cells are there to help replace that old degenerated cell. So here's what it looks like when we do the therapy. That's the shock that comes out, the spark that comes out that creates that sound wave. So we're going to do a sample treatment on me today. We're going to be doing 300 impulses. Normally we do 500, but for your benefit, we'll cut it down a little bit. So we use a gel because otherwise this rubberized membrane would not move so well. We use a gel to help couple the action of the sound wave and to allow me to move the instrument. And what we're looking for is an area where I feel it the most. Okay, so you got to feel it to heal it. Two things you feel when we're doing soft wave. Either you feel nothing at all, and that's over healthy tissue, or you feel a hammering on the inside. Now that hammering on the inside we can make so I have to peel you off the ceiling, but I don't want to have to do that. I want you to tolerate it at a level that you can accept, 6 or a 7. But I can tell you right now that patients have come to love that hammering on the inside. They know something is happening. They know that we're in the right area. The machine is self-diagnosing. It'll tell us where to go, and as we do it there, actually, the sensation dies down a little bit as the inflammation is driven down. So let's start it now. We'll spread out the gel, normal ultrasound gel, and what we're looking for is that area where I feel it the most. So once we do it, we turn it on, and we look for those areas of increased hammering. Okay, and typically for knees, it's right over the kneecap, right over the patella. And I feel it there pretty good. And I'm going to want to hold it there for a few pops and then move on to find another area. And I know my knee, typically I feel it down in here, but everybody's different. Everybody's different. Some people feel it right across the top. Some people feel it down here like I do. And I know for me that another good spot is right over here, over the meniscus. That's a great spot for me. I feel that pretty good right there. The normal treatment is 500 impulses. As I said, that takes about 3.5 minutes. So we're set at 300, so I guess we're going to do this for about 2.5, 2.75 minutes. And then once we're done, we just clean up the gel, and you can go on your merry way. Typically speaking, patients get off the table even the very first time, and they feel something has happened. They feel that pain is reduced, inflammation is reduced, pressure is reduced, maybe even a little bit improvement in the flexibility or range of motion. So yeah, right there, I feel that pretty darn good. And as I tell my patients when we're getting close to the end, almost done. Some patients like to take a little bit too much, and then there's a bad reaction. So we encourage you to just keep that sensitivity level at a 6 or a 7, not to jump into that 8 or 9 range, because it's not always good. More is not always better. That's it. 300 impulses for me. Again, typically 500 impulses. So that's what SoftWave is. That's how it's helped me. Better sleep, better sitting, less pain, up and down stairs without a problem. I anticipate it will get better even yet. We see shoulders, we see hips, we see knees, and we see, of course, we see backs and necks. So if you have an old worn out joint that needs help and assistance and you want to avoid surgery, this is a great opportunity. We're doing a $49 special to try it out, see if it works for you. And I'll do one step better. If you come in for $49, check it out. If you do not feel a change, we won't charge you. How's that? Can't lose. If you feel something, you feel a benefit, then we can talk about the treatment plans. So that's it for now. Dr. Peter Holst here, checking out, providing solutions for better health naturally.